Hi, welcome everyone. We are glad that you're here. My name is Amanda Dove, and I'm the Director of Corporate Partnerships for Nationwide Children's Hospital Foundation and On Our Sleeves. And we are just so thankful to have you here today. Thank you for committing to learning how to talk about children's mental health responsibly. We're really excited to have you here. So a little bit about On Our Sleeves, if you are new to our group. Our mission with On Our Sleeves is to provide every community in America with free resources necessary for breaking child mental health stigmas and educating families and advocates. Together, we are working to save children's lives. The need is great right now, and kids don't always wear their mental health on their sleeves. 1 in 5 children right now is living with significant mental illness, and half of all lifetime mental issues start before the age of 14. There is an unprecedented need for evidence-informed content and support for children, and no child or family should struggle alone. So the work that we are doing is really addressing that need both in Ohio and across the United States. And we're so grateful that you are taking the time to learn about this important issue and advocate with us. So a little bit about On Our Sleeves and Nationwide Children's Hospital. Like I said, On Our Sleeves is the movement for children's mental health, and it was developed and is supported by the behavioral health experts here at Nationwide Children's Hospital. So that's how we all work together. We're the home of the Big Lots Behavioral Health Pavilion as well. The Big Lots Behavioral Health Pavilion is really incredible. It's a national model really for pediatric mental health care and research. And it's also home for the Center for Suicide Prevention and Research, where our experts are always working to better understand the causes of suicide in children and inform and share prevention methods. So in addition to developing and distributing free evidence-based educational resources nationally, all of the research findings from Nationwide Children's Hospital and our clinical care information is also shared freely to improve the care for children everywhere. So we're really excited to be able to share more of that with you today. So why we decided to put together this webinar is really to help companies when they decide to come on board and support On Our Sleeves and advocate for children's mental health, to teach them how to do that in a really responsible way. And it's really important for companies right now. It's definitely something that we saw and continue to learn throughout 2020. Customers don't just want a company to talk about important issues, they expect action as well. They want you to walk the talk, and they will support a business loyally or stop supporting a business entirely sometimes based on how companies show the sincerity of the causes that they champion. So we really want to help you learn how to do that in a responsible way today when it comes to children's mental health. So a few things to always keep in mind. Number one, and this is just with any cause that you decide to champion as a company, but number one is to listen to and learn from the experts. And we are really lucky to have Dr. Parker Houston to talk to us about that today. Number two is to look at your business and to really think to yourself, do we need to make changes within our business that support children's mental health in a better way? And then number three is to look for ways to invest your company's time, talent, and treasure to support the causes that you're championing as well. So those are kind of the best talking points as far as like how you are taking the information that you learned today and applying it to your business and how you support children's mental health moving forward. So without further delay, though, I am so glad to have Dr. Parker Houston, the clinical director for On Our Sleeves, here with us today, and he's going to teach us how to do this responsibly. So now you can already check off that number one part of that list of listening and learning from the experts. So I'm going to hand it over to Dr. Houston.
Thanks a lot, Amanda. Thanks everyone for being here and for, as Amanda said, committing to learn more about how to advocate for children's mental health. I'm Parker Houston. I'm a pediatric psychologist here at Nationwide Children's Hospital, but my favorite part of my job is being the clinical director of On Our Sleeves. And so I spend a lot of time talking with people who want to learn more about children's mental health and wellness and want to be able to talk about it in a more thoughtful and informed way. And the first thing that I'll recommend is just to become educated so that you can be comfortable and confident talking about this. One thing that we know is that children's mental health can get to be a scary topic pretty quickly. A lot of people don't approach it because they're unsure of how to respond to certain things that a child might say about their mental health or about worries they have. And so the more that you think through how to have those conversations, the more you'll feel like you can approach and ask some questions and really have that conversation. And you don't need to be an expert to have it. You just need to learn some basic facts, and On Our Sleeves is a great place to learn some of those things. So we'll talk about some of the resources we have here in a minute. The first thing that you can do for anybody out there is just show that you care about this cause, whether that's someone that you know is struggling with someone, either themselves or someone in their family or friend circle with a mental health concern, or even if you don't, chances are they are struggling with something or someone they know is. And so just showing that you care about this cause and that you're willing to talk about it or be a listening ear is something that can be really important for everyone out there. The last thing that we want is to feel like we have to go through this alone. And so if they have people who show that they're willing to engage in a conversation and not just brush it off or not know what to say back, that can be a really helpful thing. Another thing is to watch the words that you use. Language is really powerful. And I know that from my work as a clinician, as a psychologist, that the words that people say and how they use them can be both healing, but also hurtful. So I try really hard in my life to avoid using words like crazy or insane or nuts when I'm describing a situation or a person or something that's happened, even if I think that it is something that is out of the ordinary. I might replace that with something like totally unbelievable, or I've never seen that before, or that seems totally wacky. And at first it seems a little unnatural and you might have to practice. So maybe just identify, here's a word that I know I say a little bit more than I should, or something that I'd like to stop saying. And here's what I'm going to replace it with. And every time you catch yourself, just repeat it. And you can even do that in social environments. Say, I didn't mean to say crazy. What I meant to say is that's totally unbelievable to me, or that's something that I have never seen before. And so you start to catch yourself and you'll form a different pattern in your language where ultimately you can alter the way that you talk about things. Another thing you can do is show kindness towards people. It doesn't matter if you are talking about mental health or not, just purely showing kindness about the people around you, your coworkers, your friends, your family, especially when they seem like they might need a kind word or a kind gesture. It goes a long way for both your mental health and theirs. There's a lot of research that shows that simple acts of kindness benefit both the recipient and the giver of those acts. And so, things like picking up something that someone drops in the parking lot at Kroger, or opening a door for somebody, or dropping a note off at someone's doorstep or in their mailbox that you haven't seen in a while. It might be a relatively small gesture, but it can really help make someone's day and improve their mental health and well-being. Then we also want to reinforce the connection between physical health and mental health, because we often talk about how physical health impacts the way that we feel day to day. We talk about exercise as something that benefits some people's mental health, but there's a stronger connection than that, and it's bidirectional. So if someone's not feeling well mentally, chances are they're not going to feel well physically either, and vice versa. So if you know that someone is going through a physical health concern, or someone in their family, you can be pretty well assured that they're having some mental health concerns related to that. And you can just acknowledge that and say, it must be so hard to deal with that. Or, what could I do to help you? Would you like to schedule some time to go on a walk with me? Or would you like to schedule time at lunch to sit outside and get some sunshine when the weather cooperates? Those are things that, even though they're meant to improve our physical condition, they certainly benefit our mental health too. Another thing, know the resources. There are lots of resources out there. when it comes to children's mental health, we'd like to think that On Our Sleeves is the leader out there in informing people about children's mental health and wellness. And so you can go to our website. We have great resource guides for lots of different concerns that parents and other adults might have, but we also have guides for how to be proactive and how to be action oriented when it comes to how can we improve resilience, how can we improve emotional health, or how can we form good practices and good habits early in life for our children that will benefit them long term. And then we can also just spread the word. Part of becoming a corporate partner or a partner in any sense, part of our alliance at On Our Sleeves is that we'll send you an advocacy toolkit to help you share some of this information responsibly. And, as much as is out there on social media and online, sometimes just sharing reliable statistics and information to bring awareness to a cause can make a huge impact too. It can bring other people to want to learn more about it. And so we have some ready-made ways to share things on your social channels or other ways through your company or your personal network. Another big thing that we can do is to be intentional about mental health and mental wellness in the workplace. And it's becoming a large focus for us at On Our Sleeves. We're actually in the process right now of designing an entire curriculum on children's mental health and wellness that can be deployed in companies across the United States, across the world, really. And that'll be released sometime either later in 2021 or early 2022. But in the meantime, what you can do is share evidence-based content, find an article on mental health and wellness that you could share amongst your employees as part of maybe a regular newsletter or a weekly series or a monthly or quarterly series. Bring in speakers who could talk about mental health and wellness and show people that it's a focus, that you're taking time out of a business meeting or a staff meeting to focus on their mental well-being and that of their colleagues. You can distribute lots of different types of educational materials as well. On Our Sleeves, we have a large library of materials, conversation starters about parenting during the pandemic, which is, a current topic and hopefully something that what we're writing about some of the strategies to overcome things like stress or school difficulty or behavioral challenges or emotional difficulties. We're applying them now, but they're really the same things that we would apply in any difficult circumstance someone finds themselves in. All of our resources are available digitally. They're all free. They're easy to access. You can reproduce them. You can distribute them however you would like. And so we try and make it as approachable as possible. And then if you happen to be looking for something specific, you could either contact us through the On Our Sleeves website, or you could get in touch with the corporate partners here at Nationwide Children's and the Foundation, and they might be able to help get you something specific. Other things to do in the workplace are gather people together and participate in a mental health event. There are lots of, throughout the year, different time points in the year where there are, I like to call them mental health holidays, World Kindness Day or Mental Health Awareness Day or, Choose Your Cause. And so sometimes it's great to just highlight, this month, this is a focus and here's how we're going to implement that in our company. We're going to, have a wellness check-in every Monday or something like that. And you can also implement things in a general work day. Like, you could have something for any day of the week that might work for you, Mental Health Monday or Self-Care Thursday or Feel the Love Friday, anything like that, where it's just something that you can get people to participate in. And the most important thing is that it comes from leadership down and that you show them that as a leadership team and as a management team, that you care about mental health and wellness and that it's a topic that's okay to discuss in the workplace, that you're supportive of those discussions and that you really care about that for your employees and their families. And then, finally, some things you can do in your community and neighborhood. We all want to make a difference where we live. I'm no different. I do this all day, every day at work. And then I come home and I try and think, in my neighborhood group of maybe 10 families within a few mile radius of where we live, how can I really impact them? how could I bring this to them in a way that doesn't seem like I'm pushing my work at them when I get out of my job. But doing things like being a mentor in your community is wonderful, whether it's coaching a team or working for an after school program or volunteering in a school or doing anything like that. You can reach out and find ways that you could interact with either individual kids or groups of kids where you could share this information in a conversational way and mentor someone in that way. Try and make your neighborhood safer. Share these materials with your groups in your neighborhood. A lot of us have, like a neighborhood app or a Facebook group or something like that, where you could reach out to your neighborhood and say, hey, I saw this and I thought, this would be great to do in our neighborhood, or this was great information that I thought I would just share. And even if you're only reaching a percentage of the group that you're sending it to, it's still reaching a group that you send it to. And it's surprising how many people might respond and say things like, wow, I've really been going through something. Thanks for sharing this. Or I saw something similar. Let me share this as well. And all of a sudden it opens a conversation that didn't seem possible before. And then, find other ways as a neighborhood to participate in activities. Depending on what type of neighborhood you live in, you could do things like encourage people to watch a movie together or read a book together, or you could participate in an online webinar and have a discussion about it afterwards. Or you could do a mental health check-in with your team at work if you're in a workplace where maybe you just have a small team that is a little bit more tight knit, and you could have a little bit deeper conversations about how things are going. And then, of course, always feel free to connect with us at On Our Sleeves through either signing up for our e-community to get some periodic emails, or you could always just contact us or the foundation team directly and let us know how you're using our materials and what else you are hoping to use. We're always developing new things, and we're happy to hear feedback and information and any suggestions you have about other ways that we can support movements like this and these type of conversations in the community out there to improve children's mental health and well-being. So thanks again for listening. I'm going to pass it back to Amanda to follow up with a little bit more information for you.
Wow. Thank you so much, Parker, Dr. Houston. But thank you so much for taking time to talk to us about this. I know when our team first went through the advocacy training, it was eye-opening for us, and we work here at Nationwide Children's Hospital, and but we've all seen some really great, I think, things that have happened just from learning how to implement those small changes into our everyday life and how we interact with businesses in the community. So thank you for talking to us about that and kind of helping to answer some of the questions that I know we all had in our mind as well. So thank you so much. And just to wrap it up and kind of tie it all together, right? For us, especially if you are one of our corporate partners, new to us here at On Our Sleeves. So we talked about, taking time to listen and learn from the experts, and taking time to look at your business and identify those changes that you can make to better support children's mental health. And then finally, learning how to invest your time, talent, and treasure to support children's mental health. So as far as what that looks like from a corporate perspective or from a business owner perspective, we have lots of great options, and our corporate team here is really happy to sit down and talk with you about all the different ways that your business can get involved, that your employees can get involved, and really not just advocate for the cause or post about the cause, but really learn how to champion this cause for children. So a couple different buckets I'll go through real quick. One is social media activation. So Dr. Houston shared about our advocacy toolkit. So along with being taught by Dr. Houston how to talk about this responsibly, we then give you the tools. So you don't have to worry about recreating the wheel or anything like that. We provide that for you so that you know that you are sharing good evidence-based content. So we've got a lot of different activations that can happen with social media. We have lots of great ways to involve your employees. So employee engagement is so important for corporate partners, and we definitely want to help you with that and learn how to build that out as well, from taking part in mental health events that happen. And we have those that happen both in person and virtually. So there's lots of options no matter where you're based. And also just, kind of providing you with lots of resources that you can share with your employees as well, to really help them engage with the cause. We have lots of options for in-store campaigns, from point of sale and selling our wonderful On Our Sleeves icons at your point of sale, to tying in with merchandise, to percentage of sale campaigns. We can put it all together with you and your team, and then put together a launch and a whole campaign that helps you to not only advocate and educate, but also to then fundraise and support the cause financially as a corporate partner as well. And then finally, but definitely not least, is all of our sponsorship opportunities. So there are lots of ways that, perhaps you're not a brick and mortar location that has a register, but you have funds that you would like to support the cause. There's lots of ways that you can do that through sponsorship. We've got events sponsors, matching sponsorships, advocacy sponsorships. There's tons of great options, and we'd love to sit down and learn more about your business, and what kinds of impact you're looking to accomplish, and then put together some customized options of how best to implement that with your business, and then work with you to actually put together those different pieces of collateral, media, marketing, all of that stuff. And even legal help. So we definitely want to make sure that we are working very closely with you to help you with any of these levels of engagement that you'd like to participate in as you step into advocate and be a part of On Our Sleeves. And so to wrap it up, though, I do want to leave you with a bit of inspiration, because I think that's always the best way to end one of these things. So I want to share with you a word of thanks from one of our former patients, a patient champion and a fierce advocate for On Our Sleeves, is our patient, Julia. So she was seen at Nationwide Children's Hospital as a teenager, when she was experiencing thoughts of self-harm and suicidal ideation. And I'm going to actually just read her words to you, because her words are better than me even trying to summarize it. So I want to share with you the impact of what On Our Sleeves does. Julia said, "I left Nationwide Children's Hospital feeling empowered and validated, realizing that asking for help is worth it. Most importantly, I left knowing that although my battle with mental health was not over, I had an endless army of fighters at Nationwide Children's Hospital standing with me. To me, Nationwide Children's means freedom. It means the freedom to be vulnerable, broken, and scared. It's the freedom to not be okay. It's the freedom to heal. It means the freedom to overcome. Nationwide Children's means not only the freedom to survive, but also the freedom to thrive, no matter my diagnosis." So I just want to thank you again so much for being a part of this movement and for taking the time to learn how to do it responsibly. And we can't wait to be in contact with you soon. Thank you.